Now promises to set aside monies in the county budgets to employ more doctors, more so specialists. Now, speaking at a joint press conference in Kathwana after a 3-hour meeting, COG Health Chair and Tharaka Nithi Governor Muthomi Njuki and KMPDU Secretary General Davji Atela said most of the issues that necessitated the calling of strike by doctors are being addressed, including better pay, with the periodic meetings slated to reach a consensus.
Unions and the Council of Governors. The Council of Governors Health Committee is expected to bring on board all key players in an effort to spearhead the rollout, which will largely function through the primary care network law. To this end, the Secretary General of the Kenya Medical Practitioners, Pharmacists and Dentists Union, Davji Atela, paid a courtesy call on the COG Health Committee Chair, Governor Muthomi Njuki, at his Kathwana office to discuss the place of doctors in the new health scheme.
We've had lots of arguments. We have seen that the county actually is doing well. We do not have many of the issues of health workforce. But in our discussions, the county has given very critical and important commitments.
We want to acknowledge that the role that the KMPDU is playing currently in Kenya is more or less working on a relationship with the counties who have the biggest health force for the health sector. And they are giving us a lot of advice that can be able to add value in how we can be able to improve our services.
During the meeting, it emerged that most of the issues of concern, including promotions of doctors, enhanced medical cover for health practitioners, and better pay, are either being addressed immediately or budgetary allocations will be availed in January supplementary budgets to address what has been left out.
In the next financial year, they're going to see to either increase the number of health workforce. They've also looked into the way to retain the consultants so that they can actually attract more and retain them with a plan that those who actually happen to could be having a plan to leave the county, they'll be having now more benefits and a very lucrative plan.
If we're able to employ more doctors, for example, we have seen the gaps that are there in Tharaka Nithi, and the advice of employing more doctors will ensure that we have more patients, and more patients will also bring more revenue where it is applicable, and therefore it will be a win-win situation. We promise that we look at the issues they have raised with their members in Tharaka Nithi.
There is also need for the capacitation of community health promoters who will be working closely with both doctors and other health personnel in reducing congestion at referral hospitals as the government advocates a preventive mode of addressing disease as opposed to a curative mode.
Looked into the issues of NHIF within the county, or we call it the insurance, and the county has taken an undertaking. They're going to make sure that all these healthcare workers and workers within the county are able to access the care. And with the bigger approach that we have had today is not only on the health workforce. The county also is looking into how to invest better to have the wananchi of Tharaka Nithi actually seek care within Tharaka Nithi without really overlying into other places.
We have harmony in how we shall implement the promotions of health workforce, and also we have asked on our part that they need to continue talking to their members who are the medical doctors to continue upholding professionalism at work. It does not make any sense promoting a doctor because they can pay